Hi, welcome to Siskiyou Spotlight. My name is Deborah Brannon. I'm the Executive Director of the Siskiyou Media Council, and we produce this show periodically to highlight events and people and interesting opportunities in our county that you might not otherwise be aware of. So today we're going to focus on rural health training and also workforce development in general. I have three wonderful guests with me today. I have Jonathon Andrus, who is the CEO of Fairchild Medical Center, and I have Amber Clapp, who is an RN up at Fairchild Medical Center as well, and David DeLalana, who is a doctor up at Fairchild Medical Center. And I will ask them each to introduce themselves and just tell us a little bit, Jonathon, about just a little bit about your background and what you do up there. And
sure. I had the good fortune of moving to Siskiyou County about 10 years ago with my family, and I've been CEO at the hospital, Fairchild Medical Center, for the past several years. Prior to my advancement to the role of administrator, I was an assistant administrator. I have experience in larger corporations such as Catholic Healthcare West, and was trained through graduate school through a master's in healthcare administration program, originally from southern Utah.
big change of scene.
Yeah.
I've never seen southern Utah, by the way. I still have that on my list of
Beautiful
things to
country.
do. I know it is. I'm tired of seeing it in books. I want to go there. Amber.
I grew up in Siskiyou County, and I did all of my schooling here at COS, fortunately, and I work as an RN in the emergency department at Fairchild, which is a great experience.
You have a nice new emergency facility up there too, don't you?
Yes.
I remember when that was being built. Thank you. And we're going to hear more about your story in a while. Thanks. David.
Well, if you want a change of scenery, my wife and I relocated here in 2006 from Honolulu, Hawaii.
Yes, and you bring the islands right onto the set with you, okay.
I became a private family physician up in Wairika in October of 2006, and have worked at the hospital since relocating, and then became the chief of staff of Fairchild last year.
Very nice. Big job. And is that where you're from originally, Hawaii? You just said you...
No, I'm born in New York City, actually.
I'm a New Yorker as well. There you go. Okay, show's over. No. Jonathon, maybe you can tell us briefly, just give a very brief overview of Fairchild Hospital. It is different. It's not part of a larger consortium or foundation or whatever, such as Mercy Medical. Tell us just very briefly about that before we get into workforce development.
The Fairchild Medical Center is a provider of acute medical surgical services, both inpatient and outpatient. We characterize our standing as freestanding or not affiliated because, unlike many of the smaller organizations across the country, we remain freestanding. We have a local board with full fiduciary authority to govern the organization. We also are private, nonprofit, and have served the residents of Siskiyou County for many, many years. We have a medical staff that is made up of primary care physicians, hospital-based physicians, and specialists also that have served very well for several decades. Specialties such as orthopedic surgery, general surgery, and others.
Okay, nice. And I've seen it. I remember, as I said, I remember when I was up at that newspaper, at the Daily, when they were building the emergency room. So I recall that. You have a new facility now, too, across the street? Didn't something...
We are, in fact, the open house is this week, so it's been an exciting time for us. This is a project that has been 2.5 years in the making, and we are completing a significant expansion of our outpatient, one of our 3 outpatient clinics,
Nice.
Fairchild Medical Clinic. We also have a clinic in downtown Wairika, Siskiyou Family Healthcare, and a clinic in Etna, Scott Valley Rural Healthcare. But this is a pretty significant expansion for us across the street from the hospital at Fairchild Medical Clinic.
Very nice. Open house this week, huh?
Thursday night,
Thursday
and
night.
would love to invite all to join us.
Thank you.
Thursday night, August 25th.
Okay.
We're really excited. It's been a major project, and I think will really serve the organization and the community well as we address some of the issues that we'll be talking about.
I was just going to say, what a perfect lead-in to the departure point for our conversation, which is workforce development in Siskiyou County. You and I have talked. We will talk about medical training in a moment and talk about our new Rural Health Sciences Institute and so on, and the ability that we have now to offer rural healthcare training to encourage people to stay here and work. But it's a bigger issue than that. I mean, you're talking about, now I'm realizing too, not just, we had talked about secretarial and IT people and groundskeepers, and also we're talking now about contractors, construction, I mean, just about everything.
In my view, workforce development is a key issue across many industries across the country. Certainly in healthcare, Siskiyou County, the service industry is a very important industry, and healthcare is probably the primary contributor within the service industry. And we are only as good as the staff that we have to provide the services. And so across every level of our organization, workforce development and training is a key priority and strategic issue for us.
And we talked earlier about the collaborative efforts that are made to bring COS and its programs forward, not only in medical training, but also, I mean, we have welding training and lighting, and heavens knows we have some television production training here as well. David, what's your sense? You've been here just not quite so long, and you see that we are about 45,000 people in 6,300 square miles. We have one small college. What do you see in terms of workforce development? What are some of the opportunities?
Well, it's very challenging. I mean, we are in constant, I think, from a medical staff standpoint, we are in constant recruitment for personnel and staff and services that we don't have or aren't able to provide locally, not because we don't have the infrastructure to provide them, but because we just don't have the workforce. We don't have the personnel to provide certain services, and it's very difficult to recruit and, you know, attract and retain people to this area to provide those services. So it's a challenge.
It is, and of course the hope is, from my point of view, the hope is that we can get some of the people like Amber who were born and raised here. We can provide sufficient training for them all across the board, and then provide the work. But at least, as you said, both have said, at least in the medical field, the work is definitely here.
There have been several studies actually that have shown, at least in the medical profession, that if you can actually train people locally from rural areas and raise them up through the professional ranks, that they have a much, much greater chance of staying locally and working and providing services within the rural communities.
Deborah, just to characterize this issue, to talk about the level of importance, it really is an extremely important issue for our organization. There are a couple of market forces that I think that are causing that. On the one hand, you have an aging population that are demanding more services than ever before.
Yeah.
And so we have that challenge of having the capacity to accommodate that demand for services. On the other hand, when we look at our own workforce, those that are providing those services, we have an aging workforce. And across the country, and of course nursing is probably the largest sector of healthcare professionals. You have, you know, within the employed ranks of the hospital, of course, you have many tens of thousands of physician providers. But I think the number that I saw was 3 million nurses, licensed nurses across the country. 34% of those nurses are older than the age of 50 years and older.
Wow.
When we look at our own organization, Fairchild Medical Center, 54% of our nurses, compared to the national number, are older than the age of 50. And so for us, this to me signifies, and this goes across really, I could give several examples of departments that have a wonderful, experienced workforce, but we're going to be challenged as we move into the future to find replacements, again, within the hospital, clinical and non-clinical, but also with our physician providers and partners.
So what I think you're saying here is that we not only reflect that, the statistics here not only reflect, in terms of the nurses and aging, not only reflect the country, but it's exacerbated by the fact that our population is so much older. So our percentages are higher. This is what you're saying. 54% versus 34% over 50. Okay. Well, I'm over 50. And I'm still working. Who's going to take my place? I don't know. Yeah. Well, you know, let's. So specifically, the value to Fairchild provided by the Rural Health Sciences Institute, which is on the COS campus in Wairika. I know that right now there's a nursing program there. I believe I understand that there's actually more built into the building that is being utilized right now, so that there are ways to, for instance, offer X-ray technician training, because there's, I think, lead in the walls or whatever that you have to do. So how does RHSI impact Fairchild now in a positive way? I can't think of any negatives. And where do you see that going? And after we talk about this for a minute, I want to ask Amber to talk to us about her experience there.
Well, yeah, and Amber has a great story.
Yes.
I think there's no question in my mind that we enjoy a good partnership with the college, with the Rural Health Sciences Institute. 40% of the nurses at Fairchild Medical Center were trained through the program. Now think about that number, starting out as licensed vocational nurses, and then having the opportunity, many of them, to upgrade to a registered nurse, and then to even continue their education beyond their 2-year registered nursing degree, which is available. And as we've talked before, while the college has been a great partner in providing the classroom instruction and a location for the classroom instruction, we have been a clinical partner where students from the college have been able to come over to the hospital and receive a portion of their clinical training, and so that's been a benefit to them. And again, to the organization, when you have 40% of your nurses that have participated in this program, that's a tremendous benefit to the organization and ultimately to the community.
That's enormous. Yeah.
You were talking about some untapped potential for the for the facility. One of the biggest challenges for a rural physician is to get ongoing, continuing medical education. You know, that's a big requirement for the job and for your ongoing proficiency in medicine. And typically, as rural physicians, we need to travel to the big cities to get this.
Are these for what we know in other professions as CEUs?
Yeah, we call them CMEs in medicine. Just, you know, medicine's always got to have a term for everything. But to get our CMEs, typically we would go to San Francisco, or I've gone to LA a few times, sometimes even clear across the country. The last time I recertified for ACLS, Advanced Cardiac Life Support Training, so for emergency resuscitation, I did it at the Rural Health Sciences Institute.
Oh my, wonderful.
And they have these wonderful mannequins, and you know, I mean, it's just a tremendous facility. You know, imagine what else we could do from a CME standpoint in that facility for our local physicians. So.
Great point, thank you. Good story. Amber, let's hear your story. So you are a native. Where were you born, in Siskiyou County?
Actually, I was born in Riverside. I moved to Siskiyou County when I was 11. So
okay, that's close enough.
Yes, exactly. I grew up for the important part of my life here. Yeah. And I actually had moved away for school and wasn't sure what I wanted to do. Nursing was never even in my mind.
On the radar.
And I had an injury, so I had to move home. And then I heard about the nursing program at COS, and so a good friend from high school and I applied together, and at that time it was luck of the draw, so I was number 11.
Wonderful.
And I remember her calling me. I was out of town and she was the first one picked, and then she told me that I was number 11, and so we were very excited to be able to go through that together.
Yeah.
And then I graduated the LVN program in 2007. I had been working at the hospital because I knew I wanted to try to work there when I was finished with school.
At Fairchild?
Yes, so I wanted to get my foot in the door. So I started in the business office, and then they wanted me to go be a tech in the ER, so I got to experience that. And it's funny that that's where I ended up being at the end of this. So I graduated the LVN, and when I was in the LVN program, they were in the works of creating the RN program here, which was excellent news because I knew that the Shasta College program was really hard to get into, plus, you know, being graduating from the LVN, I thought I had a good chance of getting into this RN program. And so I did, and I graduated in 2009, and the great part about being in such a small community is I really got to know the students I was in class with, and now I get to work with them as well. So we just get to grow together and watch each other learn, and it's just a great experience.
Fabulous. And so can we assume, I won't assume, does the high school friend that you went through the program with, does she work with you at Fairchild as well?
She is still an LVN, and she's actually in the RN program right now, so I'm going to be by her side encouraging her to make it through.
What's her name?
Nikki Autry.
Big shout out to
Yes,
Nikki Autry.
yes.
Wonderful news. We're very glad.
Yes, I'm very proud of her.
Nice. And so you were telling me earlier you work in the
emergency room.
Emergency room.
Nights. So we get to see some exciting stuff in there.
I guess exciting is one word for it.
Yes, that is one word for it.
Nikki used to work at our office, so shout out.
Yes.
Oh, okay, there you go. And you live in Wairika?
Yes.
And so do you just you look settled, you sound happy? And
I am very happy.
Yeah.
Very happy. And I am incredibly thankful that this program is such a good program. I feel like I have gotten as much preparation as I needed to be able to do my job safely and competently. So
Lovely.
Definitely a good program.
Lovely. You know, you're having been here then from the time you were 11 until you... See, 11 is a good number for you.
Yes, I think so.
Moved here when you were 11, number 11 in the choice, yes? And David, you were mentioning earlier something that you've observed about people who were raised here and their interaction with patients. You were mentioning that...
Well, a big challenge as a private physician in my office is to be able to attract and hire and retain a competent staff in the outpatient setting too. We usually use LVNs at the office. And the graduates from the program here have been an excellent source of local employees for us over the course of just the 5 years that I've been here. So we've never had to hire out of the area. We've never been understaffed for any significant period of time at the office, and that's all due to the program here. I mean, without the program here, I could imagine that life would be much, much more difficult for me.
And how do your patients like having local...
It's always a bonus. I mean, you know, some of these older patients, when they come in and they see the girl who grew up next door, who was literally 5, is their nurse at the clinic, that is a big source of pride and joy.
Very nice, very nice. What about in the administration? This is actually, I'm going a little bit off topic here, but what about in the administration? Are there people coming into Fairchild? Do you have some local recruitment even into administrative jobs? And how does that, in other words...
Well, we do, Deborah, and there are a number of examples that I could give. I don't think it matters whether it's in a non-clinical role, an administrative role, or a clinical role. I think what you're hearing us say, at least from the employer's perspective, is that we find great value when we can establish an employment relationship with somebody who is familiar with the area, who has learned to enjoy the wonderful lifestyle and the many opportunities that this area has to offer. You have reduced turnover, which is tremendously expensive and burdensome to large organizations and small organizations. And so when you can find that goodness of fit, so to speak, between an employee and an employer, it lends to a longer tenure, and we think there's value in that. I think that when we talk about the Rural Health Sciences Institute, you know, two things. One, Again, from our perspective, when you can offer an opportunity for someone like Amber, is part of our local community, to continue her education and have that initial training, in this case as a licensed vocational nurse, I think that's a wonderful thing. All right. But secondly, I think as we move forward in our partnership, it's not just about the initial training. I think there will be opportunities to continue to work with the college and with the Rural Health Sciences Institute to maintain that competence with the wonderful facility that they have, both the technology and the staff. And we are engaged in dialogue as we speak to explore further those opportunities to, again, not just provide the initial training, but to maintain that level of competency that we're looking for.
So, and some similar, you're referring to what David was talking about earlier, the CMEs?
Yeah, or CEUs.
CEUs, right.
Tomato, tomato.
And additional trainings too. That was the point I was making before, is that this is my understanding, is that we'll be able to start and complete trainings in certain technical medical tech fields.
Because we need ultrasonographers and radio techs and, you know, cardiopulmonary people.
Right.
Laboratory
takes a village to run a hospital.
Definitely.
Do you have any memories, any strong memories of some of your practicals? I didn't get to ask the RN who was on with us last fall from Mercy, but I'm thinking of you as a student, and you've been working with mannequins and working with your instructors and your students, and then you're in the hospital.
I'm not sure if my strong memories are appropriate for
I see. Okay.
But I have great memories of my clinicals, and I think another thing that helped is when we did our clinicals at Fairchild, we also really got to know the staff. So then when I started working there, I felt very comfortable working with them, and it was an easy transition going from school to work. So I appreciated that.
And you, we're coming to the close of our time here, but you had mentioned earlier that you had to do some of your clinicals down in Redding. You had to actually leave the county. And Jonathon, you mentioned that you're in conversation with the nursing board, the California. Can you talk a little bit about that?
Yeah, right now we are approved as a clinical site for the LVN program. As licensed vocational nurses continue their education to pursue the RN degree, and then licensing through the Board of Registered Nursing, we are looking to be approved as a clinical site for that LVN to RN upgrade program. And so we're working closely with all of the key stakeholders to try to make that happen, so that as these students go through and as these nurses go through this program, that they can stay here and receive their clinical training at a local site and not have to travel and deal with some of those issues.
Expenses.
Yeah, expenses and the weather and whatnot. Right. And is Fairchild doing that on its own? Are you collaborating with the other hospital in the county, or how is that working?
We're very much collaborating with the college, with the other providers, and with all of the key entities in terms of county and state.
Wonderful. Is there good news a short way ahead, or are you still too much in the negotiation?
Well, we are right in the middle of the discussion. I think we're optimistic that we can get this done, but certainly it would be premature to make any announcement.
We can't have any breaking news on today's show. The journalist in me goes, shoot. Okay, that's okay. Anyway, I appreciate your talking about it, because that has been part of the conversation about RHSI and about the RN, the upgrade step up, or whatever it's called, to RN, is the difficulty about having to go to Redding. I've heard that for years around here, so I'm glad to know. So at least we have a little breaking news that we're now in conversation with the powers that be. Anything that's occurred to you as we've been talking that we haven't touched on yet? We all look at each other? No. Okay. You had talked about staff access to scholarships when you and I spoke. Does Fairchild offer scholarships for? Can you talk a little bit about that?
We can. We have access to a number of different scholarship programs, primarily through the foundation at the hospital. And there have been a large number of the nurses and other staff that have been able to access these scholarship resources as they pursued additional training. So it really, I think, has been a great resource and is something that's frequently used.
And that's ongoing through, so the foundation, similar to the COS Foundation, fundraises and then makes those scholarships available.
Yes, in fact, I've actually used some of the scholarships to go on and get CEUs and be trained for things I needed to do in the ER, so it is very beneficial to have that available.
Very nice. I think that is important in our county. Yeah. Were there people in your class from sort of the off the I-5 corridor? Doris, Scott Valley, Tule Lake, McLeod?
Actually, in my RN program, there was someone from Walnut Creek, and there was a lot of people from Oregon, from Grants Pass and Medford and Klamath Falls, so
nice.
It was nice to see people gathering here to do our program, you know, rather than us trying to go out and find it. So. And
I think that as Jonathan and David have talked about, I think that as RHSI begins to mature and the program, the opportunities grow there, I think that we'll pull from around our area, from a wider area as well.
Maybe we can pull some physicians in.
It's hard, isn't it?
Wishful.
Yeah, I know. We've lost a number of physicians just in Mount Shasta just in the last little while. It's very hard. Okay, well, I'm really appreciative that you came today and that you shared your experiences with us. I want to thank you very much, and we'll be showing this to the whole county. And of course, you can always watch our shows on mctv15.org. We stream live to the internet. And on that website also is a tab on the home page marked schedule, so you can find the schedule and find out what's on TV or the internet viewing. Thanks so much, and thanks for watching today Siskiyou Spotlight, Rural Health Training with Jonathon Andrus, CEO of Fairchild Medical Center, and Amber Clapp, RN at Fairchild Medical Center, who came through the COS program, LVN and RN, step up to RN, and David De La Lana, who is a doctor and the Chief of Staff at Fairchild Medical. Thanks so much.
Thank you.
Thanks for watching.